Well, my name is Dr. Grogans. I'm one of the general surgeons here at Palestine Regional Medical Center. And March is Colon and Rectal Cancer Awareness Month. And I wanted to take a moment to talk to you about the importance of your screening colonoscopies. One of the reasons we want to emphasize awareness and early screening is that colon cancers and cancers of the rectum are among the leading cancer diagnoses in the United States. However, if it is detected early, it remains one of the most treatable cancers in the United States. It is a very common cancer. On average, if you look at all men and women in the United States, approximately 1 in 25 could be affected with the disease in their lifetime. This disease is common enough that the age for screening has recently been lowered by both of our cancer societies from the age of 50 to now age 45. And that reflects the importance of early detection and treatment. It is also a very survivable cancer when found early. So colon cancer is one of these diseases that when symptoms develop, it's often at later stages. The whole goal of the colonoscopy program is to detect these things prior to the development of symptoms. But there are certain signs and symptoms that you certainly should see your doctor about right away. And these include symptoms like vague or kind of an annoying abdominal pain, changes in your stool habits, as in new constipation, changes in the size of the stool, painful defecation or painful bowel movements, as well as bleeding or the passage of dark stools, unexplained weight loss, changes in your appetite. All of these are sort of vague symptoms, but can be seen with cancers of the colon and the rectum. So the screening for colon and rectal cancer, a simple answer is that the average American should be screened starting at age 45. That was a recent change from the age of 50 that had been for a long time. However, there are some patients for whom screening should start even earlier, and those include patients with certain genetic syndromes or those who have a family history of colon and rectal cancer. So it's very important to talk to your doctor and start thinking about that sometimes even before the age of 45, depending on individual risk. So we emphasize the colonoscopy exam because this is the only screening tool we have whereby we can also intervene and treat precancerous growths called polyps. Now, colonoscopy is the only test, again, that can do that, but there are some other non-invasive tests, and these include some stool studies. So stool samples can be sent in or checking for the presence of blood or polyp DNA or cancer DNA. So there are some non-invasive alternatives to colonoscopy as well. So it's important, in my opinion, to just get one of those things done when we're making the initial assessment of cancer risk. So a little detail about the colonoscopy procedure. I meet a lot of patients who have anxiety or concerns about it being painful or complications. This is a very safe procedure in experienced hands. It is a painless procedure as well. Patients are, in most facilities, completely asleep. The exam duration does vary, but I'd say it takes on average 30 minutes or less. And your physician can give you a pretty good answer on the spot as to whether you had any growths in your colon or not. And it's a procedure that you go home for. It doesn't require overnight hospital stay. Preparation is another thing that is well tolerated. There are a lot of options for bowel preparation, so I hear that a lot. But don't let that deter you from getting it done. You can talk to your doctor about some different ways and easier ways to prepare for the exam, but it is really a painless procedure. So regarding screening for colon cancer, there are certain risk factors in certain patient populations that may be at higher risk for colon cancer. And so it's an important conversation to have with your doctor about your individual risk and when the right time is to start screening for you.